Elacestrant is FDA approved for metastatic breast cancer, but we know the mainstay of management for localized ER-positive breast cancer is endocrine therapy. So the idea was, can we move elacestrant to early breast cancer where majority of patients are treated and they can have access to this therapy? You need a randomized study to evaluate that. So the elegant study is looking at elacestrant versus standard of care endocrine therapy in early breast cancer. There were a couple of options in terms of study design. The team and the steering committee, in collaboration with the sponsor, landed on the design of what we call a switch strategy, which is patients can receive 2 or up to 5 years of endocrine therapy, and then after that, switch to elacestrant versus standard of care endocrine therapy, continue that. The reasons for the switch design were multifold in terms of looking at tumor biology and as well as the changing landscape. In the current era, CDK4/6 inhibitors are FDA approved, and they're given in the first 2 to 3 years, ribociclib for 3 years and abemaciclib for 2 years. And so, because this was asking a question of one endocrine therapy as monotherapy versus another, with the changing landscape, it was felt clinically it would be best after CDK4/6 inhibitors. And so this trial does allow prior use of CDK4/6 inhibitors. And once they've completed that, they're eligible for this study.